So this is Gilda's Club Kansas City in partnership with Turning Point. And Dr. Myers, you're free to go ahead with our Chemobrain class today.
All right, beautiful. Well, good morning, everybody. I hopefully won't have a frog in my throat the whole time that I talk. Welcome to the session. It was just great to see so many people sign on, and I saw some names that I recognize. So hi there to old friends, and hello also to new friends as well. So a special thank you to Clara for the invitation to talk with you today regarding this topic, which is something I'm pretty passionate about, which will probably come through during the conversation that we have today. But the title of the presentation is Chemobrain, Cancer and Cancer Treatment-Related Cognitive Changes. And what we will discuss today is what that is and why we think it happens. And then we'll spend some time talking about what we can do about it. I'll review a number of strategies that are commonly used and have been found to be helpful by various people. And then we'll spend a little bit of time specifically talking about the evidence, what the evidence shows, and then I'll give you a highlight of some of the research that we're currently doing and some of the research that we're planning to do in the future. So that'll be kind of how we go. And as Clara mentioned, we're going to save the questions up for the end, just so that it's organized and the recording can be captured appropriately. So to start with, cancer and cancer treatment related cognitive changes. What is it and why does it happen? Well, you've probably heard this term. In fact, we have it in the title of today's talk, chemobrain, which is kind of a common terminology for this phenomenon that, as I'll share with you today, it's really not a very accurate title for what we're talking about today, because the type of cognitive changes that people experience are not only due to chemotherapy. Chemotherapy, we know, can be a causative factor for some of these cognitive changes, but it's not the only one, because the cancer itself can cause cognitive changes, as can some of the other common treatments for cancer, including things like endocrine therapy. For example, we would suppress estrogen for women with breast cancer in many cases, and we would suppress testosterone in many cases for men with prostate cancer. And it turns out both estrogen and testosterone are important for cognitive function. So the cancer itself and the variety of treatments all can play a part in what we're talking about today. So what are we talking about today as far as the cognitive issues that people experience? Well, primarily the definition would be a form of mild cognitive impairment that's attributed to cancers which are not starting in the brain or other parts of the central nervous system. Obviously, cancer that's in the brain could have a significant impact on cancer, on cognitive function. And it's really been more recently that we've understood that cancers outside of the brain can have an impact on cognitive function. So that's why I sort of highlight here non-central nervous system cancers and the related treatment. And what people describe is forgetfulness, having trouble focusing or concentrating or paying attention to something that they need to do to accomplish a task. A very, very common experience that people will describe is difficulty finding the right word or word finding issues. That's probably 100% across the board the most common issue that is shared by people that are having this experience. Trouble losing things, specifically problems with multitasking, where maybe that had been something that they were particularly good at before the cancer diagnosis or the treatment. Multitasking can be very challenging following the diagnosis of cancer or during or shortly after treatment. And then there's also individuals who describe difficulty driving, even to familiar places. So directional orientation, finding their way from point A to point B can be challenging. As far as what we would see when doing neurocognitive tests, the issues would be related to short-term memory. So not long-term memory, but more short-term memory, like a recent conversation or an appointment that you need to remember, or a list that you're trying to take with you to accomplish things might be difficult. Processing speed slows down. the amount of information that you're able to handle and how quickly you're able to handle that information. And then something called executive functioning can be affected. And basically what that means is being able to identify all of the steps that are needed to accomplish a task, and then being able to execute those steps in the appropriate order to accomplish what it is that you want to do can be a challenge. And the time frame for when this type of problem happens is pretty variable. So if we take chemotherapy, for example, a subset of people would begin to notice some of these changes that I'm describing pretty quickly, like within that first 3 cycles of chemotherapy, whereas other people may not really notice anything's different until they've completely finished their treatment and life, begins to get back to normal. The dust kind of settles, and all of a sudden they realize, oh, something's different. Memory and concentration doesn't seem to be as sharp as it was before all this happened to me. Why is that? What's happening? And recovery is also somewhat variable. The majority of people within 1 to 2 years after having finished all of the treatments will feel like things are pretty close to being back to baseline. But then there's a subset of people, for reasons that we're still not sure, that have more long-lasting issues, even as far as 5, 10, or 20 years out. And we're very much interested in figuring out what's different about why those people have longer problems. And the consequences of these cognitive issues can cause a pretty big impact on people's work life, home life, and social life. And the incidence is actually pretty prevalent. You can see here that as many as 75 to 95% of people who've been diagnosed with cancer and gone through cancer therapy will experience some of this issue at some point along the trajectory of their treatment. So pretty common. And if we pulled out breast cancer specifically, the reports for breast cancer survivors having some level of cognitive issue at some point along their treatment trajectory is as high as 83%. So pretty common. And actually, it's a pretty challenging thing to study because there's so many confounding and contributing factors. The one challenge that we're up against is there's not really a gold standard assessment that would be considered standard of care. So you might say, well, neuropsychological testing, would be the gold standard, but that's problematic for a couple reasons. One is it would be really time consuming and really expensive to send everybody who got a diagnosis of cancer to have a full neuropsychological exam. But maybe even more importantly is there is a disconnect between what people experience in terms of knowing that things are different for their memory and concentration and attention, and how they actually perform on those neuropsychological tests. And the bulk of people that we're talking about in this conversation today perform within normal limits on those tests, but yet they know that they're having a change, but we can't always prove it on paper, if you know what I mean. So there's a disconnect between what people experience and how they perform, probably because these tests are not sensitive enough to this type of cognitive change. They were constructed and developed for something completely different, which is issues after a head injury or after a stroke, or for people that are struggling with dementia or Alzheimer's. That's what those tests were designed for, not this type of cognitive change that we're talking about. And to further complicate matters, a pretty significant percentage of people will start to experience cognitive changes before we start the treatment. So when would you test them, right? Okay, and then here's another whole list of things that complicate matters. So we know that as we age, our memory and concentration and processing speed are going to slow down. They're going to decrease over time as we age. We know that hormonal status plays a role. So for women for whom we're suppressing estrogen, or men for whom we're suppressing testosterone, that can have an impact on the cognitive function. Not everybody starts out at the same baseline of their cognitive performance, and some people are, have IQs that are very, very high or are really, really highly educated. they may be able to compensate for some of these changes because of something that's called cognitive reserve. So because of that extra padding, if you will, they're performing very well, but they themselves know, oh, this is different. I'm working a whole lot harder than I used to get this done. There's been some indication that genetics can play a role, and that actually may be why some people have more long-lasting impairment than others. There may be some genetic changes that are causing that difference. Things that go along with a life-threatening illness like cancer are things like depression or anxiety, which can help muddy the water and make cognitive function more challenging. I think anyone here in the room who's been through cancer knows how overwhelmingly that fatigue can be related to the treatment, and fatigue can contribute to changes in cognitive function. We'll talk some about dietary factors today. It may be that some chemotherapy regimens are more detrimental than others, and that kind of research is still ongoing. The longer you are out from treatment may have an impact on how well the cognitive function is recovering. So what this graph does is shows you some of the things we've already talked about, like the hormonal changes and the genetic susceptibility, but it gives you a little bit of a picture of some of the other mechanisms that we think might be coming into play here. And there's one hypothesis that indicates that cancer and/or the treatment for cancer might actually accelerate the aging process for the brain. Another hypothesis is, and this has been somewhat well demonstrated, is that some of the chemotherapy that we give actually is able to cross the blood-brain barrier, which normally would protect the brain from toxic things. And some of that chemotherapy is getting through and causing injury there in the brain. But over on the right-hand side, you see something called cytokine dysregulation. And that actually is a pretty important hypothesis, because what that's talking about are the products of inflammation that our bodies produce to fight something that's not supposed to be there. So our bodies produce cytokines in response to the cancer because it's foreign and the body tries to fight it. Our bodies produce cytokines to chemotherapy because chemotherapy are toxins that are not supposed to be there in your bloodstream, and the body tries to fight it. And as the body produces these products of inflammation, those things we know can cross the blood-brain barrier, and we know those things can cause issues with memory and concentration and cognitive function. So this kind of gives you the full picture of all of the potential mechanisms, all of which may be coming into play. And I don't know how many of you have been frustrated, depending on when your diagnosis happened and when you first began to experience these kind of changes, when you reported it to your healthcare team, if you felt maybe that your concerns weren't being validated by the healthcare team, and maybe felt like you were getting some pushback about it. Well, there really was a period of time before the healthcare professionals, bought into this. And part of that was because this disconnect between the neuropsychologic tests and what people were reporting. How can we prove that this is a problem? Or is it just depression? Is it just anxiety? Is it just fatigue? Well, we know now that's not the case. There's something else going on besides all of those things. And what helped everybody buy in, if you will, or get this on everyone's radar, came from the neurological findings that could be black and white on a scan, a magnetic resonance imaging scan or an MRI. And what was determined when scans were done was that, yes, there were actually some structural changes that could be seen, and there also were some functional changes that could be seen. And so this is when the light bulb went on for healthcare professionals, like, oh, we got to pay attention to this. This is a real problem. And if you guys have heard talks on cancer-related cognitive impairment in the past, I know you've seen this slide. This was work that was done by Dr. Robert Ferguson back in 2007 that kind of was a hallmark study that really started the whole neuroimaging initiative. What you're seeing here are the pictures of MRI scans for two sisters, two twin sisters, identical twins. They're both in the MRI scanner. They're both performing a cognitive task that gets progressively more challenging as you move from left to right on your screen here. The row on the top that's lettered A is the twin who'd been through breast cancer treatment. And the scan on the bottom, letter B, is her sister who had not been through a cancer therapy. And I will tell you that both women performed within normal limits on that cognitive task that got ever progressively more challenging. But when you compare the top row to the bottom row, you can see a lot more orange and yellow on the top row. And that is an indication that that woman's brain is activating parts of the gray and white matter there to accomplish the task. And she is actually working a lot harder to get that same task done. Even though she performed just as well as her sister, she's having to expend more cognitive effort. So this was really a seminal research study. Okay, so you're saying, all right, we know what it is, we think we know why it happens, but more importantly, what can we do about it? So we're going to shift gears and talk a little bit about some of the strategies that people have found helpful, and then we'll begin to talk about what the evidence shows. So some of the strategies to deal with, quote, chemobrain, unquote, which I've already told you is not the best terminology. The first important strategy is to rule out or begin to address some of the things that will exacerbate or make the situation worse. And that would include fatigue. It would include poor sleep, which contributes to fatigue, and also distress. And in this particular situation, what distress refers to is anxiety and depression, because both those things don't pair well with good cognitive function. So by employing strategies to reduce fatigue, improve sleep, and reduce anxiety and depression, even though you're not taking care of the underlying cause, which is the change in cognitive function from the cancer and cancer therapy, you're addressing the things that can make it worse. And so one of the things we'll talk about first is sleep hygiene. Also, you could talk about cognitive behavioral therapy for sleep or insomnia. And we won't spend a huge amount of time on that today, but here are some of the things that someone who is skilled in counseling people about improving their sleep would share with you. And that is to try to keep what happens in the bedroom to be associated with good sleep, not frustration and working really hard to get to sleep, but good sleep. And some things that can make that simpler are to reduce the amount of stimulation that you're having right before you go to bed. So things like caffeine and nicotine or exercise right before you go to bed would be something that you'd want to avoid, because that can overstimulate and make it harder to relax and go to sleep. Alcohol is a little bit of a two-edged sword, because it might help you go to sleep more quickly, but you will then have interrupted sleep. You'll wake up in the night and have less restful sleep if you have alcohol right before you go to bed. Keeping the room really dark and cool and free of electronics is recommended. Going to bed at the same time and waking up at the same time to give yourself a pattern so that you are ready for sleep when it's time are recommended. Getting exercise during the day, not right before you go to bed, but during the day, will help you build up sleep drive. And getting exposure to daylight also helps with that. So those are a few of the things that would be recommended as something called sleep hygiene. We'll also spend a little bit of time today talking about nutrition, which I alluded to earlier. And we here in America do not have the best diet. I think everyone's probably well aware of that. What is recommended for a very healthy diet is to try to balance the amount of omega-6 intake that we have to the amount of omega-3 intake that we have. And omega-3 fatty acids is probably something that you've heard about. Foods that are rich in omega-3 fatty acids are many types of fish, which you'll see some of those listed on your slide here. Non-hydrogenated or processed oils. Avocado is like the perfect food. Its only downside is it's sort of high in calories. But whole grains and vegetables and legumes, all of those things are high in omega-3 fatty acids and are considered to be anti-inflammatory. So when we talked about those inflammatory cytokines at the beginning, these would help suppress inflammatory cytokines. Where the foods on the left-hand side of your screen would be things that would actually increase products of inflammation and further contribute to chronic inflammation, which is not going to help cognitive function. So trans fats and hydrogenated and processed oils, fried foods, processed or fast foods, things that are high in added sugars, all the things we love to eat, right, would be not the best diet for your brain. So eating a healthy diet is something that can also be helpful. And here would be a picture of what a healthy plate looks like, where the protein is about a quarter of the plate and the rest are vegetables and or legumes. And you can see the Mediterranean diet pyramid on the left, where you minimize the red meat and sugars, but emphasize vegetables and fruits and legumes. The one caveat to this would be folks who have diabetes who would not want to have as much intake of carbohydrates as demonstrated here on this slide with all the bread. But other than that, pretty good advice for all of us. Other things that can be helpful would include mindfulness, which I'm sure people are beginning to hear a lot about, where you are able to take some time apart from the busyness and chaoticness of the schedule to allow yourself to center and recharge your battery, so that then you can go back to a task that's cognitively challenging, refreshed. And also being accepting of the fact that maybe you don't have to be perfect. Maybe it's okay that you make some accommodations or some changes to how you accomplish your work because of changes that you're experiencing in terms of memory and concentration. Social support can be extremely helpful as well. Friends and family are always eager to do what they can to help. And maybe one of the things that you can ask them to help you do is remember important things that you do not want to forget. Maybe they can help be your reminder, as can a number of technological reminders, which I think is on the next slide. We have a lot of technology available to us now that we didn't used to have. And part of what we have available to us now that might help with that driving issue that I mentioned at the beginning is, thank heaven for the GPS, right? It always helps us get where we need to go. And I would stress the fact that humor is a very effective coping strategy. It's okay to laugh, especially if there's a situation that you're dealing with that's different because of changes in memory and concentration. So some of the behavioral strategies that are recommended are to try to establish structure and follow routines, which will help with memory of what you want to accomplish, and being able to, as I mentioned earlier, have techno prompts. So whether you're a sticky note person or a reminder on your phone person or a calendar highlight person, all of those things are strategies that people have found helpful. Some way to write down what it is that you want to remember and putting that in a consistent place so that you don't lose what you want to remember and where you wrote it down. I know people find that to be challenging as well. But also prioritizing activities, so that if you're struggling with fatigue, mental fatigue and physical fatigue, and there's something really important that you want to accomplish, choose the time of day where you know you have the most energy to tackle that task, as opposed to a time of day when you know you're going to be wiped out. The jury's kind of still out on things like Sudoku and crossword puzzles as whether or not that's really effective in terms of challenging your brain and flexing your brain muscles. But what is showing traction would be what's referred to here as novel stimuli. And what that means is doing something that's kind of outside the box for you. learning something new, which challenges your brain in a different way than what your day-to-day things might be. For example, you might want to try to learn a musical instrument, or you might want to see about learning a new language, or you might want to try a new activity or sport that you have never tried before. Just whatever it is that's novel and something new for you can help flex different muscles in that brain, for lack of a better descriptor, and help build new neural connections that will then help overall with cognitive function. So what's the research showing? Well, there's kind of three buckets that are looking particularly good in terms of research results. One is exercise, one is mindfulness, and one is something called cognitive rehabilitation. So I'll talk a little bit about all three of these. Exercise, I'm sure any of you who've been diagnosed within the last even 3 years have probably heard the exercise sermon, which we didn't used to teach many years ago. But the results on research is so strong for the benefits of exercise. We know that people who are able to get in 150 minutes per week, and that doesn't have to be marathon, it doesn't have to be jogging, it doesn't have to be really, really strenuous exercise. It can be as simple as walking. If you're able to get in 150 minutes per week, which is the recommendation of the NCCN, we know it's going to reduce risk of recurrence. We know it's going to reduce fatigue, which seems kind of backwards. You know, how can I exercise when I'm so tired? I don't even want to get off the couch. I'm exhausted. How can I exercise? But if you could make yourself get up and be active, it will actually reduce the fatigue. So it's like backwards to what you would think. And by exercising, not only will you reduce fatigue, but you will improve sleep, which also reduces fatigue. And both those things can help with cognitive function. But then the other added benefit here, which is exciting, is that it increases blood flow also to your brain. And well, I apologize, that's my landline. We actually still have a landline, so apologies, and apologies for the recording as well. But the other take-home point here about exercise is it will decrease those cytokines, the products of inflammation that we believe are the culprits. So that's very exciting. So then shifting gears to talk about mindfulness for a minute. Mindfulness has shown very strong evidence of down-regulating the stress response, which happens as your body fights off infection or fights off the cancer or handles the treatment. It down-regulates that stress response, and it also decreases those markers of inflammation, those inflammatory byproducts. So then you say to yourself, wow, what about putting the two of those together and doing mindfulness-based exercise? Might even be the best combination. And we'll talk about that here in a slide or two. So the last thing on this slide mentions cognitive rehabilitation, which is kind of an umbrella term for a number of things, some of which are called psychoeducation, and some of which are called cognitive behavioral training. And then even more simply, cognitive training is a part of that. And I'll show you a particular study that we have been doing where we've been using a cognitive rehabilitation strategy with some good results. So all three of those things are showing positive evidence in research studies. So the first study I wanted to mention to you was one that we actually conducted and published several years ago, but we invited 363 women across the United States to take part in this study, which was done virtually by survey. And 317 of those women were survivors of breast cancer, and 46 of those women were women who had not had a cancer experience. And of the women who were diagnosed with breast cancer, a subset of them were taking part before they started their chemo. Some took part while they were receiving their chemotherapy, and then some took part after they had finished their treatment. And we asked all those women to fill out questionnaires for us about their perceptions of their cognitive function. and also about the symptoms that they might be experiencing as a result of the cancer or their therapy, and some other demographic type factors like age and menopausal status and activity and exercise levels. And what we found was the women who were exercising regularly reported less problems with cognitive function than the women who were more sedentary. And the women who were heavier, there were some women who would be considered overweight in the study, those women reported more trouble with cognitive function. And part of the reason for that goes back to inflammatory byproducts. And as the heavier we are over our weight that would be recommended for our frame, the more likely we are to have those products of inflammation. So those women reported more trouble. But very, very interestingly, as part of this study, the women who were heavier, who exercised regularly, had less cognitive problems than the women who were sedentary. So despite the fact that there was excess weight, the fact that they exercised regularly mitigated that impact on their cognitive function. So that was like a wonderful take-home message and other support for regular exercise. Interestingly, neuropathy correlated inversely with reports of cognitive function. So the more neuropathy a person was experiencing, the more trouble they reported with having some of those cognitive issues. So we thought that was interesting because of the whole, how does the nervous system play into risk factors? So I mentioned to you that we were also interested in mindfulness-based exercise. So another study that we did a few years ago and published invited women who'd been through breast cancer treatment to take part in a study where they would be randomized to one of three groups. Group 1 met weekly for 8 weeks and learned a mindfulness-based type of exercise called Qigong. And Qigong is basically Tai Chi, but a lot simpler to learn and to do. And group 2 was randomized to 8 weekly sessions of gentle exercise, which is basically the movements and postures of the Qigong, but without the mindfulness component. And then group 3 was randomized to a support group that was specifically tailored for people that had been through a breast cancer experience. And what we found was that the women that were in the breast cancer, that were in the Qigong group, had statistically significant improvement in their report of cognitive function. And they also had statistically significant improvement in the amount of distress or the anxiety and depression. The women who were in the processing speed group had improvement in, that were in the gentle exercise group had improvement in processing speed. But very interestingly, the women in the support group had improved verbal fluency, or with that word finding issue that I told you about earlier. So what we concluded from this study, which we had to be careful with how much we generalized because we did have a fair amount of attrition, particularly in group 2. The primary barrier here was having to come in once a week for 8 weeks, what turned out to be kind of burdensome for people, was we attributed that mindfulness-based exercise was better than exercise alone for improving self-reported cognitive function and reducing distress. So that turned out to be promising. Now, I mentioned to you we also did a study related to cognitive rehabilitation. And we've been very fortunate to partner with investigators at Cedars-Sinai in Los Angeles who have been delivering a cognitive rehabilitation program called Emerging from the Haze for the past several years. And this program is a once a week for 6 weeks program where there's classroom activities, some lecture and some exercises to provide people with a toolbox of strategies for things to help improve memory and concentration and decrease the impact of cancer and cancer treatment on cognitive function. And we use something called telehealth, very much like we're doing right now with Zoom, where Cedars-Sinai was able to deliver this program to us in Kansas. And we had a group at the medical center at the KU Cancer Center, and we also had a group in Topeka at St. Francis Health System. And we were able to expose participants to this program. So we enrolled 61 people, 30 of whom got the intervention right away, and 31 of whom were what's called the wait list, where the same data were collected between these two groups during the data collection time period. But then once the data were collected, the women who were in the wait group got to then have the intervention. So everybody got to take part in this intervention. We just kept the groups apart till we were able to compare the pre-post data. So we asked everybody to fill out those same questionnaires about how they would report their cognitive function. And we also had finger stick blood spot tests done from the folks who were willing. And those finger stick blood spots were tested for omega-3 fatty acid. It's because we have a section of this that's has to do with nutrition, as well as exercise and sleep, and exercises to help with memory and attention. And what we found was the women who took part in the intervention group, as compared to those who were in what we call the wait group, had an improvement, statistically significant improvement in their self-reported cognitive function. And we also did see a correlation, as we expected, between omega-3 fatty acid blood levels and cognitive function. So we're really excited about this. So what we'd love to do now is expand this work beyond breast cancer survivorship to include all solid tumors. So, you know, colon, prostate, etc., but also some hematologic malignancy like Hodgkin and non-Hodgkin lymphoma. And we'd like to test this, what was done as a live broadcast from Cedars-Sinai to Kansas in a pre-recorded format in sites throughout the United States. So that way, each site could choose what day of the week and what time of day was best for them and their participants, as opposed to having to do it at the time that Cedars-Sinai could deliver it. And so we take part in research at something called a Clinical Trials Research Network, which is a group of sites like ourselves all across the United States that all do research together, so that you can enroll a lot of people in a shorter amount of time and answer your questions in a more nimble and brisk way. And this concept has been approved by that Clinical Trial Research Network and is now going to be reviewed by the National Cancer Institute Steering Committee. And if they approve it, then we'll be able to open this up across the United States. And since I made these slides, they were supposed to review that for us on May 26th. We got a message on Monday that they're actually going to review it tomorrow. So stay tuned. I hope to be able to invite you all to take part in this soon. Okay, so now let's talk about the research that's actually going on right now and some of the things we'd like to do in the future, and then we can open it up to questions. So I mentioned to you that there's kind of a disconnect between how people perform on those neurocognitive tests and how it feels to them. So they feel like they're working really hard, they're spending a lot of effort, they are working more difficultly to do things that require attention and concentration, but they're still performing well on those tests. What we believe is that if we are able to measure the amount of cognitive effort that people are expending, that's probably a more accurate indication of the cognitive changes than the neuropsychological test performance. So obviously magnetic resonance imaging is one way to do that. But having to put everybody through an MRI scan is expensive and burdensome, and not everybody likes to have an MRI scan if they have issues with claustrophobia, that kind of thing. It turns out that as you expend cognitive effort, your pupils dilate, and that's something that can be measured. And what you see here on this slide is a small camera that's a scanner that measures people's pupils dilation. And at the bottom right of the slide, you can see the waveform of that pupil dilation and how it's actually converted to a number, which is between 0 and 1 and can be compared so that you can determine cognitive effort. So we have done one study in the survivorship population for people who've been through breast cancer experience, where we had 23 ladies who had breast cancer and had breast cancer treatment, and 23 ladies who had not been through breast cancer. Those 46 women took part in the neurocognitive test while we looked at their pupils and measured the amount of pupil dilation. And what we found in this study was actually exactly what we had expected. The women with breast cancer reported more issues with cognitive function. Both groups performed just fine on those tests, but the women who'd been through breast cancer had greater pupil dilation, so we're working harder to get the job done. And what we'd like to do next with this work is to look at something prospectively. So these were women who had already finished their cancer treatment. We'd like to evaluate women at the beginning of their cancer treatment, and then at the completion of their cancer treatment, and then a few months later, to see, does this pupillary response predict cognitive effort over time? So we're writing grants as we speak to try to get that research funded. Now here's a study we have going on right now. This one is open and enrolling. So if anybody's interested in this, I'd be more than happy to send you information. But this is an intervention that is called game-based cognitive training, or also referred to as speed feedback therapy. It's an intervention that was first tested in Japan for people with breast cancer and people with prostate cancer. And it involves the use of portable cycle pedals that can be done in your own home, that are connected to an iPad or tablet, that allows you to do a brain game, if you will, while you're cycling. So it's a combination of exercise, which we know is good, but also a novel stimuli for the brain, which we also think is good. And by doing the two together, we would hope to see some improvement in cognitive function. So this study opened up in October, and we're comparing the effects of the intervention for cognitive function for people with breast cancer between people who have the intervention right away and then a wait list, like we did for that other study. So here in the United States, we're going to enroll 60 women, and they will enroll 60 women in Japan. We're collaborating with Hiroshima University and a woman like myself there, who this is her area of research. Her name is Mika Miyashita, and I've enjoyed getting to know her through the Oncology Nursing Society conferences that we both attend. So we'll enroll 30 people at KU, and we'll enroll 30 people in Denver. So we'll have 60 women who have breast cancer, stages 1 through 3, that would report some issues with cognitive changes. And they would need to have finished their treatment at least 6 months ago, but not more than 5 years ago, just so we could kind of keep apples and apples for this small study, and need to be able to do mild exercise without, issue. And we're asking those women to fill out the questionnaires that I described before. We're doing a short test of processing speed with them, and we're evaluating them before they start the intervention, at week 4 when they finish the intervention, and then again at week 16. And we're asking them to do the speed feedback therapy 3 days a week for at least 5 minutes a day for 4 weeks in their home. We're taking the equipment to their home. And so far we have enrolled half of our 30, so we need 15 more people. And we're inviting everybody who takes part of that study to do an optional sub-study if they want to, where they give us one of those little finger sticks of blood like we did with the omega-3 fatty acid. Only this time the finger stick of blood is looking at the products of inflammation that I told you about, to see if those change for the people that are going through the intervention. We just recently finished a study for men with prostate cancer, where it's a 12 weeks of weekly interaction virtually at home. You don't have to come in for this, for diet, nutrition, and exercise, to try to minimize some of the side effects that go along with suppressing testosterone. And those men were also invited to take part in a sub-study where we evaluated cognitive function to see if this intervention would help with cognitive function. And so we're just starting to analyze those data to see if our results are what we had hoped. But additionally, we're writing a grant right now to see if we can get the funding to add a component of cognitive behavioral training for sleep improvement to this study, and also to see if we could change all of the assessments to virtual assessments so the men didn't have to drive in to the research center to take part in this study. And we have a grant being reviewed as well for people with Hodgkin and non-Hodgkin lymphoma to take part in a weekly yoga intervention. So not Qigong this time, but yoga, chair yoga actually, so that nobody has to bend into a pretzel. For this study, we're suggesting that after the gentlemen or women come twice and are able to do the yoga moves without issue, that they could do the rest from home virtually, much like we're doing right now on this Zoom test. And we're also going to ask people to do the little finger stick test here to look at those same products of inflammation that I mentioned to you before. So we'll find out, hopefully within the next couple weeks, whether or not this study gets funded. And lastly, one thing that we're very interested to know is the newer immunotherapies that are being used to treat a number of different types of cancers. Do they have an impact on cognitive function? And we have a unique opportunity to study that right now, because one type of immunotherapy called checkpoint inhibition has been approved for first-line treatment. Whereas some of the research that had been done before with checkpoint inhibitors were only done with people who had already had chemotherapy. So it was hard to tease out what was due to the chemo and what was due to the checkpoint inhibitor immunotherapy. So we have a grant under review right now to see if we could do kind of a registry type of study where we would evaluate self-report and some neurocognitive testing for people as they go through checkpoint inhibition therapy to see whether or not we can determine the impact that it has on cognitive function. And real quick, I would just mention that there is a wonderful organization called the International Cognition and Cancer Task Force. This is an international group that is solely devoted to this area of research. People from all different disciplines meet every other year to share their research and to network with each other and to think of new ideas. It's just a marvelous, marvelous group. And we met this past February in Denver before all the travel and things got shut down because of the pandemic. And it's just my favorite meeting in the whole world. It's just a wonderful place to validate the research that you're doing and get great ideas for even taking that research further. So that really concludes the lecture part, and we can open it up to questions.